Hello, my name is Nate Page. I'm going to talk a bit about the ADHD assessments that we do here at Northfield Dynamic Therapy. If you're watching this video, you are probably searching for an ADHD assessment for yourself or someone that you care about. And we understand how anxiety-provoking that process can be. Most everyone, when they come in for ADHD testing, are feeling a bit scared and nervous. Well, what if I am not diagnosed with ADHD? What would that mean? What if I am diagnosed with ADHD? What would that mean? What if I actually have ADHD, but the evaluator doesn't recognize it and I'm misdiagnosed? Or what if I don't have ADHD and the evaluator thinks I do and then I'm misdiagnosed with ADHD? And so it's pretty common if you're in that place. And our process, it's the gold standard for ADHD assessment. And we want to get you the most accurate understanding of you and what's going on for you. Because if we can get you the right diagnosis, that will help you get the right treatment to be able to improve the things that you want to improve. Just to let you know, our process, it takes about 3 to 5 hours, and we schedule a 5-hour block of time is the way most people want to do it. If you want to break it up, we can do that, but most people, it's better just to get it all done at one appointment. We can do it all online for most every client. So we can do the whole interview and all the tests entirely online. But if you want to come in person, we can do that too in our office in downtown Northfield. There's 3 results that you might get through this process. The first is that we confirm that ADHD indeed is what's going on for you, that's part of your central nervous system, and that's been something that's been going on for you your whole life. That's most often what happens, and when people come in believing that they have ADHD, usually that's what turns out to be correct, that yes, ADHD is what's been going on all along. The second result that you might get, however, would be that we disconfirm ADHD and we find that instead something else was causing those ADHD-like symptoms. And so we really explore the anxiety disorders, we explore depression, PTSD, bipolar, all of those types of things, and trying to understand, is ADHD what's going on or something else? So that's not as common, but that is a result you might get. Then the third result that you might get in your report, and this in fact is by far the most common, is that we see that yes, it is ADHD and there's something else going on. And in fact, there was a study in 2022, meta-analysis looking at adults with ADHD in the United States, and 80% of adults with ADHD also had another mental health diagnosis. The most common being substance use disorders. I think the second most common was anxiety disorders, and then things like depression and trauma and bipolar and other things like that. And so the work that we do a lot is to understand if ADHD is there, and if it is, that's usually primary. That was there from birth, but then it's pretty easy for things like OCD or social anxiety or some of these other mental health concerns to get hooked into that, sometimes from a very early age. So that's the most common thing that we see. And like I mentioned, we want to give you the best diagnosis and really help you understand what's going on for you. Because the next step after the assessment is we give you the report, and then with that, you're able to take the first steps into getting the treatment that you need. And when ADHD is a part of the picture, oftentimes people are wanting to seek accommodations through their school or their work. Oftentimes medication is one of the things people are wanting to explore. And there's other treatments or coaching or things that might be helpful. But then of course, if depression or anxiety or other things are also part of the picture, we want to help you get set up to be able to treat those things as well. The last thing that I'll say is we do a autism screen for each person that does an ADHD assessment with us. It's a 10-item screen. And the reason why we do that is because ADHD and autism are so closely connected. And then you have a choice after you see the results from your autism assessment of if you want to continue exploring autism and do the full battery of assessments to see if autism is also part of the picture for you, or maybe would better account for things than ADHD, and that can be the case. Or you can decide not to if you're not, at least at this point, interested in exploring autism. So hopefully that gives you a little bit of a picture of what things are like for us if you were to do an assessment with us here at Northfield Dynamic Therapy. We've been doing a lot of just 15-minute free consultations with people that are exploring the idea of doing an assessment with us to be able to answer questions that you have specific to your situation. Lots of times people are wanting some help calling up their insurance and finding out, oh, is this covered? If it is covered, how much? Or is there any pre-authorization that I need? And so we can help you understand what payment would be like and how much your insurance would cover, but then answer any other questions that you have and then help you decide, yeah, let's schedule an appointment together, or no, I'm going to wait or search for a different provider or someone that actually my insurance would cover. So we can help you with that. If you want to schedule a 15-minute consult, or if you're ready to just schedule the actual assessment, you could call us up with our phone number. You can also text us through our phone number and ask for the appointment times. Another pretty slick, easy way to do it is to use this online scheduling system. So you can click here, you would select my name. There is the option to schedule a 15-minute consult. This one's listed as a group consult, but you could just schedule it for any reason. Or if you're ready to jump right into the 5-hour appointment, you can schedule one in person or online and click here and you enter in your information. And then as soon as you submit your information, we would send you the paperwork that you would need to complete, and then we'll be on our way. And what we've been doing, which has been so nice, is we do the 5-hour appointment. Sometimes it only takes 3 hours, sometimes it takes 4, sometimes it would take the full 5 hours. But then within a few days or maybe a week or so after that, we have the report written, and then we have what we call our debrief meeting, where we review the report, we talk through your results, and help set you up for the next steps, the treatment steps for you in your situation. And so if you're wanting to do that, please reach out. And we really hope this video has helped you get a sense for what it would be like to work with us. And we wish you the absolute best luck in your journey to find an ADHD assessment for you or for that person you care about. Have a great day.